Hello, is Mr. Kerr?
Yes.
Hi, my name's Ryan. I'm a student pharmacist here at the pharmacy. Did we have a prescription for you? Did we have something?
Yeah, I believe so. Doctor should have sent one over.
All right. Do you know what it was for?
I'm not too sure.
All right, let me go take a look. It looks like we did have something for you. It
Okay.
looks like we have a nasal spray. Do you mind if I take a few
right.
minutes and go over it with you?
No, that'd be fine.
You've
I've
never been on it?
I've never used it before.
All right.
What was it called again?
Fluticasone. You might have heard of Flonase. It's the same thing.
Yeah, I've seen those commercials on TV.
Okay.
Yeah.
And you have never been on it, never used anything like it before?
I do not recall if I have been. It's been a very long time.
All right. Let me just verify some information with you. First name is Wayne,
Yeah, that's correct.
and date of birth?
It is 7/13/1969.
All right. So birthday coming up here.
Yeah.
It was.
It passed. Yeah, it was.
Yeah.
It was
How
in
was that?
July.
It was nice.
Yeah, it was actually.
Okay.
It was a nice summertime birthday. I mean, went out to the beach with family and friends and
Nice.
little beach volleyball.
Hey, that's always a good time. So we have the nasal spray. Are they using it for allergies? Did your doctor tell you anything about this medication?
Well, I came in. I had a stuffy nose, and it hadn't been going away. It was kind of persistent, and I just didn't want to avoid. I mean, I wanted to avoid anything complications because I have this other event going on in the next few days. So I want to get rid of it. I'm going to be doing a guest lecture.
Oh, well.
Yeah, it's for finance.
Yeah, you don't want to be sniffling and snuffling there, do you?
No, I want to be as clear as a bell
Oh, yeah.
and a whistle.
Well, hopefully this will work out for you. It is fluticasone, Flonase, like I said.
Okay.
What you're going to do is spray 2 sprays in each nostril once daily. You usually do that for a while until your symptoms resolve, or as long as the doctor told you to.
Okay.
There are some things about this medication. Have you ever used a nasal spray before?
I've used just like over the counter, like quick spray in your nose, like lean back, put it in there, and it kind of clears it up for a little bit. But it's kind of a nuisance.
And with nasal sprays, many people have that, oh, I need to clear out my nose, get it all out, and then just snort the nasal spray in as much as I can, as hard as I can. That's not necessarily what you want to do. To use this properly, you're going to want to shake it up before you use it.
Okay.
Give it a real good shake. And 2 sprays in each nostril, so clear out your nose. The first spray, you're going to want to plug your one nostril that you're not going into, and then you don't want to tilt your head back. You want to keep your head maybe even slightly forward, and you don't want to breathe in too aggressively. You want to just breathe in nice and slow, nice gentle breath.
So just like a normal inhalation.
Normal inhale, and I like to tell patients why we're doing that. If we breathe it in too fast, it might go to the back of your throat and not into your airway that we want it.
Okay.
So you'll do 2 sprays in the one nostril, 2 sprays in the other, and you'll do that once a day.
Okay.
There are some kind of adverse effects that may happen from this. We shouldn't be getting any of the systemic effects of this steroid that you may read about when you're reading about steroids. And remember, these aren't anabolic steroids like, oh, make me muscular.
Okay.
But they're steroids that our body naturally produces.
What is systemic?
There won't be too much systemic absorption if you use it correctly. Which, how are we going to use it? How many times a day?
You said each nostril 2 puffs.
Yep.
Twice daily.
Yep, exactly. So, and it is going to be every day, like I said. Things that might happen are just some local irritation. You might notice, an irritated nose. You might feel it in the back of your throat.
Would I want to adjust then if I'm feeling it in the back of my throat? Am I breathing in too fast, like you mentioned?
Yeah, it might happen anyway. Sometimes it's inevitable.
Okay.
But you don't want to just be, snuffing as hard as you can.
Light inhalation.
You can get some headache from this as well.
Okay.
But most of it's going to be just that local irritation in the nose if you do see anything. You'll definitely just want to store it in room temperature upright. Make sure none of that's spilling out with the cap on. You don't want to do any more than the 2 sprays in each nostril. This one's not as needed like some of the other medications, nasal sprays, you use it until you feel better. This one is scheduled just once daily, no more than 2 sprays, so we don't get some of those systemic side effects.
Okay.
Did you have any questions for me? Was there any concerns that you had?
Nothing's coming to mind right now. You did say it's a steroid, but you said it's kind of safe. Is this a guarantee? Is it going to help?
It helps. You can't say for sure until you try it.
Okay.
It does help for a lot of people. It is a pretty big mover. We see a ton of it go out.
Okay.
Very common for sure.
If it doesn't resolve my, how soon should I be expecting resolution of symptoms?
This is one that you could see it after a few days for sure.
It's not going to be right away, because I was going to ask, if I'm not seeing any clear up, should I take a decongestant like Sudafedrin or something like that?
Have you talked to your doctor about anything like that?
No, I didn't think about it as an option. I figured I'd just run that by you.
Yeah, I'd just take it for a few days and see, and then kind of recoup from there. If your symptoms aren't going away after that few days, and you said you had that lecture coming up.
Yeah, that's in a few days, and I just want to make sure that I do have it all cleared up by then.
Yeah, definitely just keep this. Make sure you take it every day, even if you don't see it in the first few days.
Just
stick with it for a little bit, and then if it's not working, after a week or so, then we may want to start thinking about a different route.
Okay.
He did put a refill on here. I don't know if he wants to see how you do on it, but there is an extra refill on here if you do need another one next month.
Okay.
If you miss a dose, it's just a once daily, so you're going to want to take it as soon as you remember. So if you take it at 10 a.m. every day, you want to try to take it at the same time every day. If it's noon, 1 o'clock the next day and you realize you didn't take it, just take it then. But if it's the next day already and you realize that you haven't taken it, you don't want to take 2 doses in one day.
Okay, I gotcha.
Yep. Did you have any questions for me, or did you have any other medications that we had for you, or was this the only one?
This is the only one that I had sent in today. I don't think there are any other ones now.
All right, well, feel free to give us a call and let me know if it works out for you.
Okay, I appreciate it.
All right, Wayne, have a good one.
Thank you. It's like it didn't work. Was it still recording? Yeah, still recording.